talk about a very fascinating approach towards therapy that is under development. With me is Dr. Nitin, and he is currently working in VR therapy. And I would like to give you the platform. Please introduce yourself and the work that you do.
Sure, Adarsh. So thank you so much for having me here
Pleasure is mine.
and the wonderful work you have been doing. It's commendable. I'm Dr. Nitin. I am a consultant clinical psychologist with Max Healthcare, as well as I have my own private practice and by the name of Udyan Mental Health Care, Unleashing the Potential, which is in New Delhi. Yeah.
So could you tell a bit about VR therapy?
So VR therapy, or as the name suggests, virtual reality therapy, is a very advanced form of therapy. As we know, very technology based. So in VR therapy, which is primarily used as a form of exposure therapy as well. So for patients who have different kinds of phobias, it could be fear of heights, fear of going on planes, fear of spiders, and so on and so forth. So, of course, as a clinician, I cannot take my patient onto a flight with me, or they can't go with me. So how we do it is by transporting them into a reality-like situation through virtual reality, exposing them to situations, and then slowly in a very safe environment. And in that safe environment, it's not only about exposure, but also teaching them certain techniques, how to overcome those situations. That is what VR therapy in a very nutshell is. Yeah.
Could you give an illustration if a client comes with a specific phobia? How will you treat them?
Yeah. So virtual reality is not done all of a sudden. I don't believe that, as soon as a patient comes, just give them VR therapy. So like any other therapist, I use few techniques. I usually use an eclectic approach using CBT, ACT, which is acceptance and commitment therapy, and other techniques, and then bringing them into the VR therapy. Because if you give the VR therapy, the exposure all of a sudden, either they'll feel overwhelmed or they might take it as a game or something like that. So a proper rapport needs to be formed, a few techniques to practice. I also told him to practice, going to the airport, not inside the airport, but around the airport.
In the VR?
No, this was without the VR first.
Okay. Yeah.
And then when we were nearing to his flying time, he had to go for a airport. So there are different kinds of visuals that we can practice through the VR. So the first VR is they are going to the airport. They are in a taxi, and then they are going to the airport. Take their level of anxiety in hand. Okay, what is your level of anxiety? And then, helping them to practice those similar techniques which they have practiced before to calm them down.
Right.
Then after reaching the airport, how to navigate through the airport. Things who are not able to visualize also because of some issues. VR therapy really helps them. Various mindfulness exercises. So the more they see the relaxation environments through the VR, they are more able to, form those kind of images while they are at home as well, while not in session. So that is also this thing. Remember is, for addictions as well.
How does that work?
Again, working through different kinds of techniques in therapy, and then, taking them in that situation, where people are trying to force that person to drink or something, and then how they have to control their cravings through the techniques which they might have learned in the session. And a similar environment could also be done for, social anxiety as well. So the environments overlap for various kinds of disorders.
So how immersive would you say the therapy is? Would you quote it in a percentage that the person really feels that they are there?
But the Meta Quest and other, Apple Vision Pro and, those kind of VR headsets, trust me, it really works because you're totally immersive in it. I was doing it with one of my relatives, and she just went into that. She was so immersive in that she, when she took that out, she was like, "Are you also real?" That was the kind of, technology that, which has come up, and how it's, just changing the whole scenario. So help of the Meta Quest, they have joysticks with it. So the environment for the person, for example, OCD, for example, going into a very bad toilet, for example, germophobia, all those kind of things. So the person can literally control himself through the joysticks. So he can go inside, he can wait. Till now, I was controlling the environment as a therapist also. That, okay, now we're about to go into that situation. Oh, now the patient can himself or herself control him or self or herself. So they really feel that they're in that situation. Or for that matter, environments such as fear of heights. It's like a very big skyscraper within which you're able to walk around with the joystick. So you're going up here and there, okay, and then as the therapist, I'm asking the patient, okay, how much you're feeling at this floor. Okay, great. You have acquired that. Now let's go on a higher floor. Things like that. So the patient himself can go here and there and enjoy that process. Yeah.
Actually, who do you think in the audience might benefit from VR therapy?
I feel any kind of VR therapy is, again, as I said, is not only situated for only having phobias. It can be used for relaxation. If someone is having a lot of stress, we can take them into nature. We can, through VR therapy, we can, there are certain protocols in VR therapy, and these companies have devised environments according to that. People who are having attention deficits, there are environments for that, to increase their attention span also. It's vast. Anyone can use it.
And for psychology students and those who are practicing, if they want to incorporate this in their toolbox, how can they do so?
So there are various kinds of, I would say it's better for a person who is, firstly, the person needs to be techie savvy, because it is a thing that requires solid flexibility. Kabhi chal raha hai, kabhi nahi chal raha hai, those kind of things. So it works, of course, but I would rather feel who is a person who is most, so people who are more into, who are more experienced in giving psychotherapy. It's like, oh, aaj game mein hum khelenge. It's not like that. It's not like a game that you wish to play. It's a proper form of therapy. Yeah. And as I said, it should not be started initially. First start with a normal set of therapeutic techniques and then take on to the VR. That is what worked for me. It could be different from person to person. It may differ, but that is what has worked for me. Yeah.
Does it require any kind of certification or other qualification?
As such, no. Of course, masters in psychology, as I feel, that is one of the most important qualifications. But I would say get some sort of experience first in terms of psychotherapy, and then get into this field. That's what I would like to say. It's not that, karte, let's start it. No. First, we need to understand also the whole aspect and then start it, basically. That's what I feel.
So last question I want to ask you, where do you practice and how can one contact you for your services?
Okay, so I usually prefer practicing this at my own clinic, which is here in New Delhi, which is in Greater Kailash, GK1. Because we require full Wi-Fi, we require that sort of atmosphere also, to start it. So yeah, that's what it is.
So how can they contact you if they're interested?
I'll share the contact details to you. Will that be fine? And you can probably provide it here with the link. That will be great.
Yeah. Okay, it was a pleasure talking to you. Great.
Same here, Adarsh. Yeah. Thank you so much.